Hello and welcome to the Pet Healer Podcast. This is your host, Dr. Mitzi Vargas, and today we're going to talk about possible side effects of antibiotics. And antibiotics are obviously a God-saving, drugs. When you have certain diseases, that's the only thing that you can think of. All the people that died in the past. In generations and societies because we didn't have antibiotics. So it's a wonderful discovery. It's great that we have them. We are seeing antimicrobial resistance on the rise. So we're kind of a little bit nervous about certain antibiotics, and newer drugs and antibiotics are being discovered and trying to be tested. But there is a lot of stories that we don't know about the side effects of antibiotics. I believe that most the pet owner population knows that when we administer, we send antibiotics to your dog or your cat, then most of the times this could cause diarrhea. It can cause anorexia, they stop eating, or it could cause different changes in like flatulence or they get lethargic. Sometimes they vomit or have other signs like hives and urticaria. Those are kind of like common reactions. People know that if the stools are a little bit loosened, then we add prebiotics or probiotics to the pets that are taking antibiotics for an infection. I definitely recommend that the antibiotics be used selectively when it's necessary, that if it's a severe infection that should be cultured before sending antibiotics. And I feel that those are responsible things to do. And I feel that most pet owners know when there's a side effect, like a common side effect related to GI or related to like a hypersensitivity reaction. But I bet couple dollars that they are not in the know about severe reactions that can happen with certain antibiotics. For example, for all cat-loving people out there, enrofloxacin, which is a fluoroquinolone type antibiotic, has a very bad reputation causing retinal degeneration in cats. When enrofloxacin came out of the market, sadly, I have to say that being in the field for 30 years, I've seen a lot of drugs come in and come out and start to be used for everything, and everybody embrace them, and then all of a sudden we start seeing side effects with the more use. Sadly, we have to use them. Is in the field that gets tested. You have to use them, and any reports of adverse reactions should be reported to the manufacturer and to their to the veterinarian, so we know. But I remember when I was a strictly cat practitioner back in '94, being very concerned about enrofloxacin causing retinal degeneration. I saw several cases of it in the late '90s of severe blindness. It was blindness, and it resolved. I think it resolved in all but one. When we stopped the enrofloxacin. So it was a scary situation. And I think the initial dosage, it was 5 milligrams per kilogram and 10 milligrams per kilogram. And now those over the time, they have a recommendation to use 2.5 milligrams per kilogram, which is half of what they recommended before for senior cats and senior dogs. And so we realized that it was dose dependent, that and the time dependent. So if you were to use 21 days of enrofloxacin, then you needed to use the minimal dose and perhaps try to do for less time. Minimal dose effective, I should say. But again, we can, we do know that there are other fluoroquinolones. Enrofloxacin was the original one, and there's a lot of things that happen there. The newer fluoroquinolones like marbofloxacin, orbofloxacin, all of those come with warnings for kidney failure, come with warnings for retinal degeneration, but the dosages that they recommend are a lot lower, and usually once a day administration is all you need. So I think that you have to be alert if your cat has been prescribed Baytril or Bax or Senequin, and all of a sudden you you're looking at them and their eyes, the pupils look really dilated, that's a cause for concern. It should be called the vet, take them over there. But I think we forget about them because the dosages that are recommended are much lower, but it still could happen. So I know a lot of pet owners didn't know that your cat can become blind just because of this antibiotic causing retinal degeneration. But again, the good thing is that most of them, the vision returns and they go back to normal once you stop the antibiotic. The other one is a very old antibiotic, the sulfonamides. A lot of people know they call it sulfa, but sulfadimetoxine. Trimethamine sulfa is what I used to do a lot. I used to do it a lot for urinary tract infections in dogs, and I kind of like fell out of favor with it because I couldn't put my finger on it, but I did see some immune-mediated disease, and especially I remember a specific patient was a Cocker Spaniel, and Cocker Spaniels, by and large, any veterinarians listening, Cocker Spaniels are very prone to get immune-mediated hemolytic anemia or thrombocytopenia. But in this pet, I remember using it for a urinary tract infection, and we usually tried 14 days, and she started to have petechia and things like that. So I really think that you could cause autoimmune disease with sulfonamide. So I recommend, if you're going to use this, make sure you culture whatever infection you're treating, culture it, and if it's the drug that you need to use, you use it because what option you have, but use it at the recommended dosage that they give. And just be on the lookout for any potential complication with autoimmune hemolytic anemia. And how do the owners will know that? Well, you'll start seeing little bruises around the body, or dark stools, or blood in the urine, or just lethargy and then just not doing good. Before it becomes full-blown autoimmune hemolytic anemia, the pet is just not doing good. Now, the third one is very common because for kennel cough, we still use, and for tick diseases, we still use doxycycline a lot. And because I do a lot of advanced dentistry, I use clindamycin a lot. I tend to use clindamycin drops mostly, but when I do the capsules, I do a once a day, administration, and I actually tell people with food. Because dry peeling or dry capsuling, I should say, clindamycin is not recommendable. It can cause an esophageal stricture. That means the esophagus, right at the lower part of the cardiac, the pill can sit there and erode that area and cause scarring. And then the lumen of the esophagus is a lot smaller. And that could cause reflux esophagitis, vomiting, and it just could cause a lot of pain. It's just not good. Regurgitation, salivation, just the choking all the time. So that's not good. So if you have to do doxycycline, definitely you have to use with food. Hide it in the food and give it in the food, or in a little piece of cheese or peanut butter, or the pill pockets. So doxycycline the same. In people, doxycycline is, has been implicated in a lot of cases of esophageal stricture. And bone marrow suppression, that's another one of severe side effects of certain drugs, but one specifically is the star of bone marrow suppression is chloramphenicol. And I have had chloramphenicol be the only antibiotic that works for certain ear infections or some skin infections in cats, and it's very or in dogs, and it could cause plastic anemia in people and in animals as well. And I definitely know that all cats chloramphenicol is going to cause some degree of anemia, and you have to be very careful with it. But dogs too. So a lot of times we don't remember, but dogs can have the same thing, can happen to us. So when administering chloramphenicol, we always recommend the owners, or we always mandate for the owners to wear gloves. We actually give them the gloves so that they don't have any excuse and they wear gloves because it can be transferred to us. So we'll use this shortest course that we need to at the lowest dose. And then that is effective. Then the last one is the CNS signs. So central nervous system signs will include like ataxia and coordination, imbalances. It could even be seizures. And I also had that happen many, many years ago with metronidazole. So we use metronidazole a lot because it's the best treatment for Giardia, in my opinion. It treats a lot of protozoal, little bacterial colitis. And we need to know that it is not a stress colitis, that it is a bacterial colitis to use it, because I feel that metronidazole is overused. There are really good herbs, like great Sazuria coptis. You can use it for 3 days instead of metronidazole, and that usually takes care of the problem is if it is a colitis type thing. But if it is infectious or if you have Giardia, of course you have to use it, but use it the minimal amount that it needs to be done. And it can be given just once a day instead of twice a day. And I think that if you do that, I think you minimize the effects. But these are recoverable. Most of these side effects that are so severe, if you stop the antibiotics, they're recoverable. So that's one of the things that I would recommend is to just be aware of the behavior of a pet. And if you see any changes while they're on the antibiotics, just notify your veterinarian, because it might be the beginning of a very severe side effect. It's not always a little diarrhea or dysbiosis of the gut biome. Sometimes it's something very severe. So I hope you learned something today, and be aware of the antibiotics. Use probiotics when if you are sent on a big course of antibiotics for your pet. Make sure you recommend, or if the veterinarian recommends to culture, that you accept that, because it's in the best interest of your pet. And again, if you learn something, share it with your friends, hit the notification button, and we'll see you in the next episode.